How is brain balance different from therapy, tutoring, or counseling? I'm Dr. Rebecca Jackson, Chief Programs Officer at Brain Balance, and here to answer that question today. It's a question we hear often, and it's a great one. Services like tutoring, therapy, and counseling can be incredibly valuable for children and families, but they often focus on developing skills in a different way than how we work at Brain Balance. Most traditional supports work from what we call a top-down approach, where I'm teaching something new to you. So for example, tutoring. Tutoring is going to work to repeat academic information to teach the academic content. Counselors work on emotional strategies to be able to identify and put support and strategies in place when big emotions exist. And therapy helps children to practice specific skills or behaviors. Again, all necessary and important strategies. But at Brain Balance, we focus on things through a different lens. We look at everything through the lens of development. Our ability to pay attention, regulate our mood, emotions, and control our behaviors, and learn in the classroom aren't things that we're simply taught. These are higher level skills that actually emerge on top of our foundational development, which is how our brain develops and connects over time. So first we need the foundation, then we develop those higher level skills and abilities. The Brain Balance program uses an integrated approach to do this. We combine physical, multisensory, and motor activities with cognitive training and brain healthy nutritional recommendations to help strengthen development and brain connectivity. So instead of only practicing the skill that's difficult, we focus on building the underlying developmental foundation that supports those skills. A gap in foundational development will present as gaps or symptoms in everyday life. To change the symptom, we close the gaps. A helpful way to think about it is this. You wouldn't try to teach a child to play soccer before they could walk, run, or balance. It's the same principle to brain development. Before we talk about regulating mood, emotions, and behaviors or learning, let's make sure your child has the developmental foundation to succeed in those areas. And one thing that we see often is that when brain development strengthens, other supports like tutoring, therapy, or counseling can actually become even more effective because the brain is better able to take in, process, and apply what's being taught. If you'd like to explore whether this approach may support your child, the best place to start is with an individual assessment at Brain Balance to better understand your child's developmental profile and what may be possible.